So we're now going to look at links of interest and what is the problem. So I'd like to call on Jean-François Bergman, Ildefonso Hernandez Aguado, Martin Hirsch, and the debate will be moderated by Philippe Leduc. So links of interest, often that brings to mind conflicts of interest, and that's the most important round table of Cham then. Not because we're sitting around the table, because it's the question of the quality of the expertise, the making the right decisions in the appropriate field, the competency of medical staff, and all of the approaches that we have in the health. Can we have interests without conflicts, and can we have conflicts without interests that are not related? So can we be virtuous in all our interests? We only have 40 minutes, so we're going to try to examine this question and reach an answer. We're going to look at things quickly and then try to examine and propose some solutions. We weren't able to set a price for drugs, but we'll see how we can get rid of conflicts of interest. So with Ildefonso Hernandez Aguado, who is a professor of public health at Miguel Hernandez University. This is your university, Mr. Hernandez? So it's Spain. You're from Alicante, yes? Jean-François Bergman, who's a professor of medicine in Paris, and Martin Hirsch, you're graduated from l'ENA, you've head of hospitals, worked with Bernard Kouchner, you're the Director General of the healthcare, the president of the Public Service Organization, and for the last 2 years, you've been the president of the think tank Health and Economy. You've written 13 books, How to End with Conflict of Interests, and that was in 2010. I don't think your book was followed properly if we're still discussing this today. So everyone's talking about links and conflicts of interests and other types of interests. So there's the American Sunshine Act, then the Cour des Comptes in France also looked at this. And to set the stage, we're going to look at a video, a short video. Related interests. So where's the problem? I shall not be influenced by desire for gain or a quest for glory, is what can be read in the modern version of the Hippocratic Oath used today in French faculties of medicine. Indeed, who would want to entrust their health to a doctor under such influence, bought by industry, the political powers, or religious sect? There are some black sheep who have crossed the line towards conflict of interest, leaving their impartial and honest scientist white coat behind them in the changing room and putting on a promoter's business suit instead. There are a few such people, but they point fingers at everybody, doctors and industrialists alike. Add a touch of media hype to a case like Mediator, and the general public will only remember one thing: they're all corrupt. The word accident is never used to refer to drug-related risks. Instead, it's always the word scandal. Although hunting down conflicts of interest is normal and should be a priority, with the sanctions applied to deviants serving as an example, people too often put related interests and conflicting interests in the same bag. Yet, does a doctor, like any other citizen without related interests, act out of interest? Independence is surely just a pipe dream. Every human being is linked to their family, friends, business, and relations. Journalists themselves are linked to their paper or show, and both look very carefully at sales or viewing statistics. Who can dare deny, for example, that taking part in research or protocols to develop a top-performing drug is not justified or desirable? Who can refuse to believe that going to a conference financed by industry in order to pick up new ideas or skills is a waste of time? To prevent people from suspecting that there are conflicting interests underlying these necessary links, transparency is essential. Since 2001, the French version of the Sunshine Act, doctors are bound to declare any related links to or agreed remuneration above 10 euros from the private sector. This declaration is compulsory. This is fantastically intransigent, if not overly fussy, threshold when you think about it, but it should be better monitored in reality if it is to fulfill this requirement for clarity and hence engender trust. The law on health includes the contract with the public authorities, and the College of Physicians is still not happy and and think that all relations should be declared. So let's start with you, Mr. Hernandez Aguado. Where do you think the conflict of interest could lie?
The problem is when interest deviate public policy and healthcare away from their interest, which is population health. I think that the problem with interest is a state capture, regulatory capture, and the capture of science and continuing physician education or the health professionals. A capture that directs public actions away from public interest. I think that we live with a striking paradox. The concern on the sustainability of our health systems and the failure to address relevant questions. For instance, why non-patent health technologies have low coverage and profit-making drugs and other devices have high coverage in spite of having low efficiency sometimes. Why are we giving drugs for non-diseases? Why we are not taking sensible public policy to keep people away from doctors, people away from hospitals? Why we don't take stronger actions to stop unnecessary interventions in healthcare? These questions.
Alors, quand même, une question, je pose à
I'm going to ask you each a question. Do you have links of interest, not conflicts of interest, but links of or related interests?
There are subtle interests that are difficult to detect. Are those interests that are embodied in the functioning of the institutions and civil society? The environment, the intellectual environment where we move, is an environment that defines the problems and frame the questions, the health issues, as a biomedical problem, always with the response that it is a high technology response. And this is the environment. If you ask to your minister, or he or she wants to increase prevention, they are going to tell you, yes, screening, vaccines, and drugs. No other ideas come up in their environment.
Alors, je vous rassure, moi aussi,
I reassure you that I also have related interests because journalists are like doctors. And Mr. Bergman, you have lots of links of interest. You're interested in therapy, and recently the magazine Cash Investigation challenged you. But we know that you're irreproachable. But for the others, where's the problem? Is there a problem? I don't think there's a problem. Well, let's talk to Martin then. When the rules are simple, you declare, you're transparent. There are rules, structures that ask us for our related interests. We leave the room if there's a decision that concerns us. And we have groups with a collegial notion, with a notion of independence, with traceability, and then there are no problems. No problems when we apply the rules in a standard way. But the real problem behind all of this is competency. It's not really who has what links. The question is the expert competent? And it's the competency and independence, which means that they can have the right level of judgment and independent judgment. And the last link in the chain, you need the right documents and the right products. That's the best solution to not require crisscrossing paths. There are no problems for good products and the right dossiers. They're easy to evaluate. So it's more a problem of competency than interests. Well, interests have their limits. You can declare financial links or interests. Okay, I'm paid 250 euros an hour. But the real links or interests are everywhere. They can be indirect. They can be emotional ones. They can be negative. My nephew works in a company that competes with another one. So the possibilities are infinite. So you say you want people without any interests or links of disinterest, the militants, the hard ones that are a bit based on Stalin, and they have positions that create conflicts of interest because they're against everything. Martin Hirsch, you have a major conflict of interest in the total affair. Your representative and the Parliamentary Commission had a link that he didn't declare. So I need to say a few words about that. You asked me if I declare any of my interests or conflicts of interests. So yes, tell us, 6 years later, after your book, How to Finish with Conflict of Interest, is this still a topic? Yes, because we'll come to your report of March of last year. Well, very quickly. We all have interests. There's a difference between direct financial interests and other interests. When you analyze what goes on, there can be that has a much stronger influence and can lead to problems of independence. For the question that concerns me, for many years I've had no other pay than that which comes from my main employer. So it means I have no related interests or financial conflicts of interest with other organizations or other private interests. And for the book on conflict of interest, I paid my royalties out to not have a conflict of interest. But I fundamentally disagree with Jean-François Bergman. And you can see we're all free as a main employer, but not exclusive employer. Yes, the university is my other employer. So as one of his employers, we can still disagree. I disagree on the diagnosis that says once transference has been accomplished, all problems are solved. Why is there a problem in my mind? There's a twofold problem, it seems. I get rid of the moral issues and a terrain that we don't necessarily want to go to, but I don't think we need to talk about that. There are two problems, one of efficacy and the other security. The problem of safety and quality linked to conflict of interest, or there are many of them, I won't go through them all, but each time we give the same reason. Oh, this was just a specific case. It was bad luck for Mediator. It was bad luck in Vioxx. It was bad luck for others. But everything else is fine. And we just come up with a little law, and then we wait for the next topic to arise because we're not really dealing with the problem at the source the way we should. And I'll come back to that very quickly. And I don't think I can forget about the little jab you sent at me for Michel Aubier. Michel Aubier really rendered a disservice to his colleagues, the environmental cause, and the confidence that the public had or could have in the medical organizations. He didn't declare any interests. You weren't aware of the conflict of interest? Well, I'm not going into the personal details. I was not aware of it, of course. And it was not in any documents. That's why I brought this before the Senate. And as you know, he declared under oath that he had no links with an economic actor linked to the environment and pollution. Why is transparency not enough? It's a necessary condition, but if we only focus on transparency, we will reduce the issues of competency. In fact, we have a problem that exists with multiple experts, each having their related interests that can be conflictual interests. They declare them because they're being transparent, so people know about them. So what do we have to assess? We end up with experts who have no competency because we got rid of all the other ones with competency. So we need to produce and maintain a stock of experts with possible independence and without conflict of interest. And if we don't deal with this topic, we'll end up with two problems. One, yes, that can exist. I can guarantee that. We'll have poor competency and we'll also be dependent. So experts without related interests? Well, we can experts without any financial interests. What is the work that we're trying to do? Jean-François Bergmann works for industry, so he has to be paid to study drugs. I also work for the APSP. Let's go back to efficiency or efficacy. In the current system, as the Director General of the APM, the hospital system, the hospitals of Paris. So we need to contribute to innovation and we need to help train. And we need to back innovation. So the approach that we had for conflicts of interest was not to say we're going to look for absolute purity and we're going to get rid of all conflicts of interest to the detriment of innovation. We did the opposite. We decided to see if we could be more innovative in terms of research on new drugs, new therapies, while improving our prevention of conflicts of interest. When practitioners, because they have a related interest with a certain company, mean that they only work on inclusion in their ward, but not for the whole study, they can give a part of the data to a certain industrial company rather than allowing us to develop it. That's not good for innovation. It's not good for industry. It's not good for medical progress for patients. So, Martin, in your report, what Jean-François Bergmann didn't like, no more medical visits, no more attending congresses. It seems very policed. So, Jean-François Bergmann, this really irritates you. Do you think what Martin Hirsch is proposing to you, but this could be true for all agencies, is this too much? Does it go too far? There has to be an interest in carrying out research. If you manage the research the way if you can't manage your research the way you want, you might give it up. Well, it's something that worries me. I'm paid 4,700 euros a month net with our pension contributions or bonuses. They don't pay my transport, my telephone. But that's it. That's the rule. I accept that for a part-time job. If I did it as a job set on Tuesday afternoons, I could go on leave on weekends. That's how the situation is. But what's he proposing? He's saying, when your association comes up with protocols, I want to manage the money, the budgets. I'm not against that. But I want the same flexibility. And flexibility at the APHP is not the specific ownership. My association works for many different things.
The interns must learn to read. Not reading is already dying when you're young interns. So we have a weekly bibliography. We've tried to do everything. Every morning they don't want to do it. At noon it's too late. The afternoon. So we decided to have a bibliography on Friday at lunch. So I actually missed it today. And I pay for the sandwiches. Since I've been paying for the sandwiches, these interns come to my bibliography session. How do I pay for those sandwiches? Well, out of my own pocket. I go and purchase sandwiches and buy the sandwiches for the interns. A month ago, I spent the afternoon, we're washing an elderly lady's hair, and I said, it's too bad. And she said, it's too bad that we don't have a hair dryer. And we went to find, and they said, no, there are no hair dryers in the Paris hospitals. So I went with the association's card, and I went to buy 4 hair dryers for the hospital. If Martin Hirsch gives me a credit card and says, you've given this much to the hospital, here, why don't you take this credit card and buy sandwiches and buy hair dryers with it? But today the system doesn't allow him to do that. They sent us a letter saying that all income, you have to wait to comment on it on February 1st. So I can't wait for February 1st to get this assigned in my budget. So can I answer about those sandwiches? Let me finish. Give me more flexibility. Give me... But then there could be problems with what we call black boxes or black money of the associations. No, obviously you're irreproachable, but let's show what we did with our corporate credit card, and you can prove that we didn't buy a Rolex watch. Is it possible to have a system that goes beyond transparency with some controls, but that allows more agility and flexibility? That was the debate this morning. That's why I really take this seriously, this problem of sandwiches and hair dryers. Yes, I hope you do. That's hard to say in French, hair dryers. And I'll come back to that. This is why the work that we did, and Jean-François Bergmann knows this very well, on the little report that we issued 5 months ago on conflicts of interest, it wasn't just my own report. It was done with the president of the medical community, the doctors in the different research committees, and I said not to shirk my responsibilities. No, it wasn't to say, no, I'm going to punish people if they have conflicts of interest. We worked with many other stakeholders who are convinced that our future lies in innovation and flexibility, just like you do. We didn't write this report to reinforce the Paris hospital fortress because I want to break down the walls rather than adding additional walls. We wanted to look again at how we could work better to succeed with less confusion in terms of interests. And so we tried to develop a policy, and I think you're fairly in agreement with this policy. And so we said, if from one day to the next we go from the policy to the application, no more congresses financed by industry, for example, it would be a catastrophe. So we said, okay, let's have an 18-month trial period to show that we can have the same flexibility for the hairdryer. And for example, you didn't... Sometimes people want an airline ticket paid for tomorrow, for example. And is there an inertia or is there any progress? Well, if we can't succeed in doing this, we'll have to find other ways. But we won't set up something that penalizes doctors and research. What did we do? Well, for example, we created a foundation that responds to all the criteria of independence and good management. And this foundation does preparation work with a certain number of voluntary ward managers saying, what do you need with your associations? And maybe switch to the foundation and see if you have the same flexibility. And we can adjust that until the service rendered is a CMR of level 1, not 8, level 1. That will be tough. That'll be tough. Do we have credit cards for the foundation? Well, the question of credit cards has been raised. Even better, Jean-François, the system in which you can actually... The foundation will reimburse you before you even had to spend the money. I don't ignore all of these details that poison your daily life, I know. So maybe the response cannot be a system in which you have more recognition to those that give you the flexibility than to those, the main organization. Take the example of the sandwich. I was invited by urologists to spend a Saturday with them during a training day for interns and clinical managers in terms of new urology practices. So I attended the presentations, and they all were concluded with long live the robot, and it was financed by the robot manufacturer, so it's logical. So you can be in favor of robots, why not? But they all raised their hand and said to me, help, your report about conflicts of interest is a problem. And secondly, I want a robot. And who paid? What did the manufacturer, the robot manufacturer, pay? He paid for all the snacks. I would like interns and doctors who've seen these medical professors spending time, I'd like them to be able to thank the hospital too. And then we'll come back to the relation with industry, because industry has the same interest that we do in clarifying things. I think that's true. Ildefonso, what is your feeling of this French debate? Do you have the same debate? Because in the end, what's being set up is more organized transparency, because transparency alone is not. Do you have the same outlook?
Debate is everywhere and with the same problems. One talking about transparency, others say that it's not enough. But I want to go back to a point. We are talking about innovation, but what is innovation? We are talking only of technological innovation. I remind you that this morning Enrique Levy said, make 5 proposals for efficiency. Said, transparency in performance, productivity, organization, prevention, and poor.
C'est 5 points de.
There's one more.
McKinsey, oui, très bien. Oui.
Incentives, and all of this is social innovation.
Oui.
Social innovation, and we are not giving money for social innovation. Why? Because the European agenda of research in health is drift towards high technology and competitivity. And it's the same inside the countries. There is no innovation at all in the social area. And if we want to stop unnecessary interventions, as the epidemic of screening of prostate cancer, and unproven and useless intervention, if we want to stop this, we need social innovation.
Oui, vous voulez dire que les liens d'intérêt.
You mean that these links of interest and conflicts of interest may hinder research in other areas, such as social innovation? Is that what you're saying?
If you examine all the documents before the Horizon 2020 of the European Union Program of Research, all the documents sent by the companies, by civil organizations, and who won, you will see that productivity and high-tech won over social innovation. That's very clear. It's true that social innovation got a 0.5% transversal.
Il faut que l'innovation sociale ait un peu plus de moyens.
So social innovation needs more investment. I'm in favor of competitiveness, but we need to have a return on the person who's the competitor. The huge problem is that at the start of the first semester 2016, I had 19% more activity in the ward, hospital activity. And did I ask for a raise or 19% more nurses in my ward? No, they'll say thank you. No. If you, it will be added to the poll, and then the GH, and then it will be, and I don't want my research activity to be just pooled in the whole unit. And people say, well, there's this guy who needs money, and you have to encourage research in surgery, and so we'll send the money to surgery so that the surgeons remain. So I won't have anything left to buy my sandwich. So, so the question is, in the orientation, we need to have some kind of carrot. And what I'm saying, I'm attached to that. And at the drug agency, is it the same problem? Yes, well, I'm very attached to the notion of links, and that's what links do. They attach people. Obviously, I'm open to him. He's my boss. He's my boss, so yes. So he's half my boss. So when, thanks to my small competency in methodology, I hope, this is why the industries contact me. Who asked him to manage $1 billion in drugs? They didn't ask me. So for the 12 years when I was president of the Comedims, he didn't give me 3 hours so that someone would replace me. He wasn't there. I wasn't there at that time. Yes, I know you weren't there, but when he was there, then I have to do 172 files of pH and choose 28, and then I'll just have all these insult letters. People say, my project was the best one. Why didn't you give me the money, the PHRC money? I did it all as a volunteer, and people criticize me, but they don't reimburse me for that. When you're doing the PHRC, you won't be able to take care of your patients. So we're consuming. Could we inject more flexibility? Flexibility? Yes, I don't want to be enclosed in something where I am asked to choose between independence or competency. I want competency and independence, both of them. But first thing, since about 1 year, there's been a minor revolution, which is a progress. We've moved away from the system of clinical trials with contracts and associations to a system of the single contract. And apparently people aren't happy with the single contract. Some people aren't happy, I know that. But what is the result? Well, the lead times to sign with the pharmaceutical industry, we've lost 20%, but we've gained 6 months. Last year in Shem, you told me it was too long and we needed to reduce these lead times. We have saved time. We've saved 6 months, yes, and we're doing more. I don't know about for you. Well, we have 20% less in inclusions. Why include if you're wasting the money? You include one just to have the name on the paper and then you stop. No. If you have minus 20%, they're going to decrease your salary too. No, they don't increase it when I work well, so they're not going to decrease it when I work poorly. No, we're talking about the flexibility of a rule and the control. Can it be flexible? There's not just flexibility that's at stake. We have improved this point. Secondly, Jean-François Bergmann is basically saying I'm paid a miserable salary, and so it's normal that I go and try to find money elsewhere. Well, I didn't say that. I understand that there is a question of remuneration, but I would prefer, and I would find it more normal. These are the discussions that we're having today with the pharmaceutical labs. If the pharmaceutical lab wants to invest more in France and innovate in France, they have a huge university hospital center that's well known all around the world. If they want to work on certain things, this should be contractualized with the hospital and then have this benefit, and they can benefit from all the skills of the Paris hospital system. And then we can remunerate Mr. Bergmann or other doctors who contribute to this and who should always be paid by the public employer for this private work. That would be much simpler, 1,000 times simpler. You would have as much remuneration as you succeed in getting in unhealthy conditions, and it would be healthier, it would be more transparent. And so I think we need to really treat this topic. This is what we wrote in our report, and we need to do it. We can't find ourselves in a situation in which I have practitioners, and this was the case just a few months ago, where I realized that I won't be reimbursed by the health insurance system for several thousands of euros of prescriptions of a drug that didn't have an authorization, without any clinical research protocol. But where are the links? But I discovered that these practitioners are paid by the lab. That does pose a real problem for me. In the 12 years when I was at the Comédimes, we did this job. When we started to see these anti-TNF for rheumatology, we took the whole rheumatology ward, we divided the number of prescriptions with a number of codes for inflammatory diseases. And then we saw 2 wards that were overprescribing in comparison with the others. We went to see them and we said, why are you doing this? We had explanations that were very consistent, very clear. So there are explanations for this, and they were not links of interest with the labs. So we need tools to control. I agree. We need to have epidemiological means to see who's prescribing what. That's how we will avoid the conflicts of interest. We need to train doctors in the Paris hospitals to have critical interpretation. Well, you're very close to what Martin Hirsch is proposing, but I'm not confident. I don't trust this. Why don't you trust it? Well, because up until now, everything that I did well in my ward actually filled the gap in the finances, and I never got my 19% additional nurses. And they're sad, and I'm sad not to have more nurses. Well, he does this to me every time. He does this to me every time. So the subject is a serious topic. In the public hospitals in Paris, there is a very dynamic activity. That's great, but not just in your ward. Yes, thank God. Well, why is the activity so dynamic? Well, because we have money to innovate and because patients trust us. Those are the two things that we need to maintain. When the activity is dynamic, indeed, we have a little bit more nurses than when there's no activity. So when you look at our head count, doesn't necessarily follow exactly, but our head count follows the increase in activity. It's not completely in parallel, no. These are the questions that the nurses asked me to ask you, but we'll do this in the corridors. Yes, we have an increase in working times, yes. Well, we're approaching, when you talk about confidence, is confidence contractual? I want to come back to competency. Martin Hirsch wants both independence and competence, but what I learned in methodology, I learned it when I was at the AFSAPS and the drug agency, and the pharmaceutical industries also taught me a lot. This competency, the interest links, I'm happy to do what I'm doing. I never asked for any additional remuneration. I think it's part of my job. But behind this work, this really kills me when people come and say, you went for 800 euros to Frankfurt for a conference. Well, it's a 3-hour flight. 800 euros, you flew to Frankfurt to try and think about the best possible way to assess a new drug and to respond to major questions of what do we expect from this new drug. And then people say to me, oh no, at 250, and the person from the Council of Doctors who says, you exceeded the price by 50 euros. And I said, are you a 10 times better surgeon than I am a good methodologist? And the surgeon answers me, for me it's not the same because it's private with my patient, whereas you, it's money from labs, and that's everybody's money, and that's the patient's money. If it's public money, if you have a policeman who's paid, and so he wasn't able to answer. I said, if you do surgery on someone who doesn't have much money, you should be charging less then. I don't think the system that you're describing is stable. When you had a problem the other day on the TV program, when they came to find you in your office, I don't think you were very comfortable and that you found that the system is stable. Well, they really trapped me, I think, for another question. But the basic question is, do we consider that the system as it is today, to answer the roundtable question, doesn't it pose any problems? Is it completely stable? And does it really favorize innovation? I'm convinced that no, it does not. And I'm not the only one. And the people in industry are also convinced that it doesn't necessarily encourage innovation. So that means several stakeholders who are convinced of this. And the Court of Accounts said that there are frequent anomalies and huge gaps. So it fragments the strategies of partnership and innovation, and it also has this sort of Damocles over the head of all of the actors. If there's any suspicion, you reminded us of one suspicion, then this erodes trust. So you step back 10 years if your trust is eroded. I don't want to look in the rearview mirror. I want to make progress. And to make progress, I am sure that in order to be able to satisfy this question of flexibility, rigidity is not inherent. It's not automatic. It doesn't mean if we're removing links of interest that we will necessarily be rigid. Because you don't trust me. That's why I say we will only do it if we are capable of proving that we can satisfy the commitments that we've made. So we'll see you here next year.
So what about you? What do you think? This debate, do you think it's Franco-French, or do you have the same concrete questions? Are you talking about the same solutions to avoid this mistrust of the public?
I worried. We don't have the same concerns. I have the concerns that we innovate in very good medicine, and we now classify mild depression as a biochemical imbalance, and we are treating millions of people with a new medicine, good innovation, good business. instead of giving them an arrangement, a community arrangement that is much more expensive and much better and don't create disease. And for me, this is the result of the shift of the whole health policy in one direction that I don't like. And what I check, when I talk to doctors, I talk to politicians that are completely unaware of these problems, and they continue this race to nowhere, giving screening for lung cancer now to every people, continue the epidemic of bad screenings that cause harm to the population. Most of the people is unaware of the iatrogenics is the third cause of morbidity and mortality in the United States. And I am surprised that you spend double the NAS per capita and you have sometimes worse indicators of health and you're not worried about this. You say, well, in this morning in Germany access is very important. Well, access could be important, but and the harm we are causing with, and I think I am in the wrong place to say these things.
Non, c'est bien, vous parlez de...
No, it's good. You're talking about the relevance of care, the quality of care, the quality of the healthcare system. And there may be related or conflicting interests in that. So thank you for what you've said. Thank you.
Conflicts of interest, and I lived this when I was Director General of Public Health with the vaccine in the pandemic of flu, for instance. And the question of when even I agree with Martin, and sometimes there are not conflicts of interest, but there are partiality. When the experts are very good experts but very specific, they behave in a biased way. If you make a group of experts in flu, very good in flu, they're going to give you an overestimate of the problem and the solutions. They're going to give you an overestimation of the pandemic, and you get afraid and you have to buy a lot of vaccines that you have to throw away afterwards.
On a bien connu ça, oui. Là, vous êtes méchant.
So you're not being very nice there. You're not being very nice with Rosaline and with France. Anyway, thank you, gentlemen. I think we've got a clearer vision now.